To speak to us, we have Sister Annette Birungi from the Uganda Nurses and Midwives Union. And we want to say good afternoon to you, Sister Birungi.
Good afternoon. How are you?
I'm very good. Why are you striking today?
We have I can say, a dispute actually with government, because since 2018 we've been consulting government about our salaries, salary increment, and we sat several times in the Ministry of Public Service, and we also actually we met the government, as in we were called in cabinet, we negotiated and told them what we really go through when we are serving. But what government has decided to do is to keep a deaf ear. We have been called in the Parliament on several committees, public service and also health, but whenever we try to explain, they try to look as if they don't know what they put in the budget. And all of a sudden now we saw there was a promise that all scientists will be increased their salaries, but the doctors are aware about the 5 million they are going to start with. But for us, we do not know, and we are wondering what is this that government is trying to play, because we have a collective bargaining agreement, the agreement that we agreed with government in 2018, and this agreement was supposed to be for 5 years. So we were supposed to get increment in 2019, 2020 and 2022. So it is actually going to expire in 2023, July. So we are like, what is our fate? What is...
Last year we did have the doctors going on strike, and you as the union actually called a press conference. You discouraged nurses and midwives from joining them. So we thought everything was okay with you. So what has changed between last year and today?
We thought that government, since we are discussing with them, you know, in public service there is a public service negotiation machinery, and unfortunately it has not sat for 1 year since when the chairman Mitara resigned. Retired. I'm sorry. We have never met, but we've been thinking that since there is a negotiation between us, we don't need to go on strike. But for all these years, we see the government keeping quiet. And the nurse who is getting 600,000 today, the enrolled nurse, they are 70% of the health workforce. So meaning that since when the economy actually, when salaries went up, when the situation after COVID, the economic crisis, there is a lot of suffering within ourselves, especially that group that has 70% workforce of health.
All right. So away from the salary increment, what other plight is faced with the nurses and midwives now?
Like as I've told you, if you are getting very little money, there is a lot. Today, transport is very high. Food is also very high. The cost of food, the cost of living generally, accommodation and others. So some nurses have been chased from houses, and you find that when you find that a doctor is given 5 million, and then the degree nurse who is in the same scale, that is another area where we are also not happy with government. The degree nurse who is in the same scale with the doctor is still on 2.2, and the doctor is promised to be given 5 million. The diploma, and that one we had agreed with government to be given 4.8, and the diploma nurse today is getting 1.2, and we think that is being unfair, because we are living in the same environment and we are also serving same people. Why should we not know what we are supposed to do?
Second, lastly, Nurse Birungi, we also want to find out, you're talking about, you know, the prices, the economic crisis, but it wasn't the case back in 2018. So what were the underlying factors that led to negotiation
in 2018? We realized that government had not increased the salaries for nurses and midwives for long, and we had to negotiate. But the issues were lying around the problems that we are facing.
Which are?
We have no accommodation, transport problems. We find the nurse traveling for a long distance, but also we wanted the structure to be changed, because today you find that the population has gone high, but we are still on the we are still on the structure of 1995.
All right.
So we're looking at a lot of things,
Yes.
work overload and so on. And you find we are being, everybody is saying nurses are not working and so on. But it's because we are very few at work.
Speaking of which, we have emergency cases right now in the different public hospitals across the country. What are you going to be doing about the emergency cases?
We just hope the government is going to come to us and talk to us. How come it has talked to teachers, it has talked to doctors? What is it that they cannot talk to us? Because we know that there is something they are keeping for us. So I don't even see why they should take all this long. Nurses are equally important.
There's no midwife that's going to be on duty for emergency cases at least. Is that what you're saying?
We have put skeletal staff. The emergency cases, people are working, especially the in-charges, they are working. We have told all chairpersons, you know, we have structures all over the country. We have told all those chairpersons to make sure they have some skeletal staff. But the most important thing is just that one, that we need to know how much is our take. Because as Uganda nurses and midwives, we are mandated by law to negotiate with government how much we are supposed to be paid for our labor. And we also have a right to withdraw our labor in case government doesn't listen to us.
All right, that's the plight representation by Sister Annette Birungi from the Uganda Nurses and Midwives Union.